Stephen Barron. He's the director of the District of Columbia Department of Behavioral Health. You may have heard of them as the Department of Mental Health, but in October 1st, they became the Department of Behavioral Health. He is a social worker, a graduate of Howard University School of Social Work, and he's done a commendable job overseeing the district's mental health services.
Thank you, Charles. It's a pleasure to be here and to see Chris take off, so I'm thrilled to be here. Also, the concept of child mental health is critically important, and the concept of policy to practice, you know, that's the challenge. It's easy to come up with all the great ideas of what you want to do, but then to put them into practice is the real challenge. And then the concept of the federal partnership and where the federal government falls in to make that happen are all important critical elements. I think a lot of that, first on the child side, those of us who have been around a while remember that in the mid-'70s, the community support programs starting out of the federal government with federal leadership for adults with serious mental illness. Following a decade later was the CAS and the Child and Adolescent program started, and it seems like the child world always is 10 years behind the adult world in major initiatives. And in both of those initiatives, the federal government provided the leadership and the framework for states to operate in and provided a large number of funding for that. But then in the 80s, we all had our addiction problems, and that was to Medicaid, and which has been a good thing, and it's really been the expansion of services, but also is very challenging. You know, the 80s get criticized under the Reagan administration for a reduction in support for human services, but for a lot of us, that's when our programs grew. And they grew because states figured out how to truly partner with Medicaid and to realize there was more than a clinic option in the state plan. There was a rehabilitation option, and Medicaid had tremendous utility. Now, as we've entered this decade and really focused on accountability, I think we've been a little sloppy on how we've used Medicaid, and we really have to realize it's not the end-all, because it does have limitations, but it has been the fuel to drive our systems of care, and then working on the accountability side. So I think the federal government has such a critical role to play, and then, of course, with the Affordable Care Act, but really on the child side with the child health insurance program that started probably towards the end of the Clinton administration, if I have that correct. Our children had had reasonable access to health insurance. We're fortunate in the district, and you're going to hear from our district colleagues, that we've been very aggressive with health insurance in the district for both the uninsured and the insured. And we're one of the first states, I think us in Connecticut, to really take advantage of the new Medicaid rules, and our newly eligible populations have grown. Just in our public mental health system, we've gone from about 4,000 people, adults out of about 15,000, 16,000 who were not covered, to about less than 1,000 who are not covered. And the undocumented individuals would not be covered through Medicaid, but would be covered through a district product. So the district has been very, very aggressive, and you're going to hear hear from some of our folks, both in the Medicaid administration and from the mental health side. You know, as you build the system of care, and Charles said it, you know, the literature is really showing that people have lifelong mental health disabilities or issues begin to become symptomatic in their teens. 14 seems to be a very critical age. I'm very excited. I hope we continue to support the early interventions for first episode care that's happening. I know there's a lot of rollout in New York and in Maryland, looking at how we organize ourselves around first episodes and borrowing from some of the adult evidence-based practices, such as supported employment and assertive community treatment. People who normally wouldn't be eligible for those services, really trying to do a higher dose of those services to hopefully offset the course of the illness so it doesn't become a disabling illness. So there's a lot of work happening there. On the child side, our challenge has been, and I'm pleased that you're going to hear from Marie Morales-Black, is really how do you build a range of services in your child system that really supports the needs, and how do you move an evidence-based practice, which we give a lot of lip service to, from the theoretical base into operations, and how do you maximize the funding so Medicaid supports it? I have my cheat sheet is 4 things that need to happen need to be in place to make that happen. And the first is that when you want to move an evidence-based practice into operations, you need to make sure that the rules or regulations that legitimize that service in your community is consistent with the fidelity of that evidence-based practice. Number 2, that with your reimbursement rate is a rate that supports that service, that people are trained and supported to deliver, or even certified to deliver the service, and that you have an accountability component. That you just, you know, you got to trust, but you got to trust and verify. And I think because there is a lot of turnover in our field, and people need the support from the government and the oversight from the government to make sure these services are delivered in a way that's consistent with the fidelity. Now, at the same time, you then need to look at some of these services lend themselves to Medicaid reimbursement. So all of us from state government and Medicaid administrations need to make sure we have a few people on our staff who, for some reason, love to read the code books and know what codes will be consistent with that model and can solve that problem. You got to always have one code book reader on your staff to make sure you can do that. So I really encourage that. You do all those things, you move it to Medicaid, you can begin to operationalize. In the district, we have good examples of that with functional family therapy, multi-systemic therapy. We've moved them all to Medicaid. We're working on moving trauma-informed CBT to a Medicaid product. And so we have a rhythm going on how you do that, and you have different parts of the organization being able to do that. At the same time, as you all know, working with kids, we need to really have strong partnerships and buy-in from our other child-serving agencies, be it child welfare, be it juvenile justice, and most importantly, your school system. You'll be hearing later about school-based services. We're really excited about that, and we're growing that, and we now have a system of care grant, which is federal funding, that's enabling us to identify a number of areas to improve our child system. One, getting all the child serving agencies to buy in and use the same functional scale. We're looking at the CAFIS. So if a child sees a clinician in one agency, and it'll be a web-based product, and sees a clinician in another agency, they don't have to repeat the same thing for the child. We're also working with our Medicaid partners in the managed care world to look at how do you get pediatricians to use standard pediatric screens, and then what do they do when they determine a child needs a specialty services. Some of our feedback is people don't do it because they don't know what to do with it when they get a positive. So, and we do know we have access issues in the whole public system. So workforce development is a big challenge, and it's one that needs a long-range plan, but we're working on access. So those are the other big piece, and there's been a lot of attention paid to this, both on the adult side, with people with lived experience to really be represented and actively involved in policy and practice, and the same with family members, and we're working on doing that. So, I mean, I think there's a lot of challenges. I think today's event is an exciting one. And I just want to end with one thing. As many of you know, in June, on June 3rd, the President had the White House conference on mental health. And out of that, there was a commitment to have community conversations around the country. Sacramento had one, Albuquerque had one, the Kansas Cities, I think, came together and had one. And October 12th, we had one in the district, and we were thrilled. We had over 400 people attend, and the focus of the meeting was on youth 12 to 24. 1/3 of the attendees, or 30% of the attendees, were between 15 and 24. And out of that, there'll be an action planning group. We'll be focusing on issues. And what came out of it, and I think very similar to the other sites, is a focus on stigma. How do we normalize getting mental health care so people who want to get it and get it in a timely manner? We have the challenge of people who want it being received, and we have the challenge of people needing it, not seeking it because of the stigma. And the other two top areas were poverty and trauma issues. So we have a lot of work to do. This conference is an important part of it, and we will be continuing our discussions to follow up on our creating community solutions. So thank you.
Our keynote speaker for this morning is Paolo del Vecchio. He is the director of the Center for Mental Health Services for the Substance Abuse and Mental Health Services Administration, which we all know as SAMHSA. Paolo was the first consumer affairs specialist hired in 1995 by SAMHSA. In this capacity, he promoted consumer participation in all agencies, in all aspects of the center's policies and operations, ranging from public education to developing evidence-based practice to address the needs of persons with mental illness. A self-identified mental health consumer, trauma survivor, and person in recovery from addictions, Paolo has been involved for over 40 years in behavioral health as a consumer, family member, provider, advocate, and policymaker. He graduated summa cum laude with a master's degree in social work from Temple University and has published widely and is a highly sought after national and international speaker. We are extremely delighted to have Mr. Del Vecchio to speak to us today. Thank you.
Good morning. I want to thank Dr. Lewis, the Congressional Research Institute for Social Work and Policy, M.S.W, the McSilver Institute, DC Department of Behavioral Health, and the Congressional Social Work Caucus for convening this event this morning. As a social worker, a federal official, as a person who's received mental health services, and most importantly, as a parent, I'm honored to be here today to shine a light on the mental health and substance use needs of our children and youth. Let's see if I can get this to work right. Okay. Author Neil Postman wrote in The Disappearance of Childhood that children are the living messages we send to a time we will not see. Those of us gathered here today must ensure that those messages are ones that are filled with hope, health, and recovery. Just last week, our nation witnessed yet another school shooting, this time at Sparks Middle School in Sparks, Nevada, by a young gunman who allegedly was bullied at school. This again raised the nation's consciousness about the complex needs of our youngest citizens. Our children and youth must be free from the violence and fear that strikes at the heart of their innocence. Sadly, too many of our children live in fear from the time that they are very young. Childhood exposure to trauma and traumatic events is a major public health problem in the United States. In America, a child is abused or neglected every 35 seconds. Some of those events are single occurrences, but others may be ever-present features in a child's life. We know from research that the more of these experiences a child has, the greater risk for negative outcomes. Such areas as poverty, crime, low academic achievement, addictions, mental illnesses, and chronic diseases, all of these have roots in untreated childhood traumatic stress. CDC estimates that we spend an estimated $124 billion a year to address the serious consequences of child maltreatment. Of course, the human costs are incalculable. I should know, because as my bio indicates, I was one of those kids. I'm going to share just really briefly a bit about my story, how I came to be standing here in front of you. My mom, who I consider the heroine in my life, was someone who experienced psychiatric hospitalization, was subject to the evidence-based practices of the day, insulin shock treatments, forced electroshock treatment. Went on to raise 4 kids by herself. Went on to get a master's degree in philosophy, taught at a local community college for many years. Nationally published poet and social activist, community activist in her own right, and a real model for what recovery is all about. My dad, who was a child psychologist himself, and was also a Korean War vet. And he never talked about his experiences on the battlefield, and yet, like many of our returning servicemen and women, he dealt with it through the bottle and was an undiagnosed, untreated alcoholic for the rest of his life. Some of my earliest experiences are of the conflict in my household, in the domestic violence that I experienced, and the trauma that I felt. And like many kids, I withdrew within myself, not knowing how to cope and deal with the situation. And the teachers at my local school, elementary school, in the 3rd grade, again, I consider this a case of early intervention done wrong. In that what they did is pull me out of a classroom in front of all my peers and said, you have to go talk to the school psychologist. And what strikes me today was the reaction from my peers. Going home on the school bus and them saying, what's wrong with you? Are you crazy? Are you psycho? And we talk about the impact of negative attitudes and what we've called stigma in the past. And that was my first experience of social exclusion because of having a label of a mental health problem. Going home to my parents, crying my eyes out and saying, there must be something wrong with me. And internalizing that pain. Frankly, that experience pushed me away from seeking services for 20 years. Why would I want to have anything to do with mental health if this was going to be the reaction and the response? So instead, like many of us, I turned myself to drugs and alcohol to deal with the pain. And so whatever kind of in my teens and through adolescence, whatever drug I can get my hands on, drinking grain alcohol before school, getting high before, during, and after school to deal and just cope with the pain. I was also bullied almost on a daily basis through elementary, through high school. One of the things my mom and my parents really instilled in me was the value of education. That's why it's really great that we have this event occurring today. And so was able to, despite this pain, begin going to college. And for many of us, that's when it hits the hardest, is in the late stages of adolescence, early adulthood. So for me, not getting out of bed at days at a time, hiding in stairwells before classes so I wouldn't have to interact with my peers, not saying a word during semesters, I felt my life was not worth living. What's the sense of going on? I was at literally my wit's end. I found myself on a subway platform in North Philadelphia, getting ready to take that step in front of an approaching subway train. And I could see the light coming down the track, could feel the rumble of the train approaching. As I was getting ready to take that step, something pulled me back, and that was the thought of my mom and the impact that that would have on her. And I made a decision then to try to get some help. Went to left that platform, went directly to the counseling center at my college, told them what was going on. They said, come back in a month, we have an appointment then. Sadly, again, that's an experience that's too often common. We talk about access, and that was a case where I did not have access. But what I found in that counseling center changed my life, and that was a sign, and it was a sign on a door for a work-study job. And again, one of the things we talk about in recovery is the importance that employment can bring to people, sense of contributing to society, being independent. And that was for a work-study job, working in a local mental health program on an information referral line, and that changed my life because I found two things there when I began that job. One, I found that I wasn't alone with these issues, that there are many other people, young adults, kids, across the community experiencing what I was experiencing. And that was liberating in itself. The second thing I found was that by helping other people, you really help yourself. And that's what's great about the social work profession, in that our ability to help others, we increase our own sense of worth and self-esteem. I went back to college, and was fortunate to get a master's degree in social work. Went to work for a mental health program after graduating, moving folks out of long-term institutionalization into the community. And you know, some folks stick with you all your lives. And one person I'll never forget, and we were moving people who were in the state hospital for an average of 40 years. And one woman who was hospitalized 30-plus years. She got hospitalized initially because she fell on some trolley tracks in downtown Philadelphia on a rainy day, hit her head, and probably had a case of what we would consider traumatic brain injury today, and was institutionalized for 30-plus years. Every day the staff would come, would lay out her clothes, tell her when to wake up, what food to eat, what TV she could watch. For the last 5 years she was at the hospital, she hardly said a word. So we went and we developed a wonderful community residential program for her, and moved her into the community, and every day the staff, probably good meaning social workers, would come and lay out her clothes, tell her when she could wake up, what food she could eat, what TV she could watch. One day the staff came and laid out her clothes, and she said, I want to wear what I want to wear. And that's kind of where our work is about. It's about giving people that choice and voice in their lives. It's about what recovery is about, giving people independence over their illnesses and living a full and happy life. I went on from that work to be able to, as Charles indicated, I was the first person with mental illness, self-identified person with a mental illness, to work at the federal level in mental health policy. And I'll share one other story here. We talk about social exclusion and stigma, in that the special assistant to the then director told me the story years later, and she said that she was going to make it her particular job to take care of this person with a mental illness coming to work at the federal level. She pictured in her mind someone coming in shuffling, drooling at the mouth. And so to make a long story short, 3 years later, we were married. And today, 16 years later, we take care of each other, our 3 beautiful children, 2 dogs. We own a home, have a big mortgage, of course, have 2 cars. And again, it's about recovery. It's about those messages of hope, health, and recovery. I certainly wasn't alone, and I'm not alone with what I experienced. Mental, emotional, and behavioral disorders are common even among our very young children. We know that up to 1 in 5 children in the United States experience a mental disorder in any given year. Many have more than 1 disorders. In terms of costs, estimated cost of behavioral health problems in young people is $247 billion each year. Of course, these disorders are costly in more than dollars and cents. Children and youth with behavioral health issues, of course, are at greater risk for substance use disorders, which include chances of coming in contact with juvenile justice systems. They have lower grade point averages, miss more days of school, and have higher dropout rates. And research confirms a significant correlation between childhood emotional disorders and problems in adulthood. As Dr. Barron noted, half of all diagnosable lifetime cases of mental illness begin by age 14. 3/4 of all lifetime cases start by age 24. Yet we know too many kids don't receive the treatment that they need. Dr. Barron also noted the White House Conference on Mental Health that President Obama convened in June. And he noted in his remarks that only 1/2 of children with behavioral health issues get help. He said, quote, "We wouldn't accept it if only half of young people with diabetes got help. Why should we accept it when it comes to mental health? It doesn't make any sense," he said. Certainly it doesn't make any sense, and our inability or unwillingness to deal with these issues can be literally deadly. In 2010, suicide was the 2nd leading cause of death among young people aged 12 to 17. Just as an aside, we know about 38,000 Americans take their lives each year. A lot of the debate, certainly the past year, has been around gun control issues. We know that approximately 1/2 of those suicides, 19,000 Americans, take their lives through the use of firearms. Again, a public health and national tragedy, particularly when we know what works. Children and youth and families who receive timely and appropriate prevention and treatment services not only recover, but they gain the tools and the capacity to cope more successfully with future stressors. They become the parents, the workers, and the community leaders of the future. A future in which healthy adults raise self-confident children who grow up in nurturing communities. This isn't wishful thinking. The science is on our side. Institute of Medicine released a seminal report several years ago that makes it clear that many mental, emotional, and behavioral disorders in young people are in fact preventable. My colleague from SAMHSA, Joyce Sebian, will be talking more about the IOM report and our work on prevention a little bit later. We know we can prevent negative mental, emotional, and behavioral health outcomes of our young people. We can and we must create an assertive agenda to promote mental health for all Americans. At the White House Conference, the President and Vice President Biden called on each and every one of us to end the secrecy and the shame that accompanies mental disorders and to believe in the power of recovery. Urgency of their message makes clear that now is the time to infuse evidence-based prevention programs into a range of family, school, and community settings. At SAMHSA, together with our federal and community partners, we're doing just that. Here's just a couple examples. Social reformer Frederick Douglass said, "It's easier to build strong children than to repair broken men." Easier to build strong children than to repair broken men. SAMHSA's National Child Traumatic Stress Initiative, strengthening individuals by building resilience among our children and youth. This program started in 2000. The network now includes more than 150 centers around the country and university, hospital, and community-based programs with thousands of national and local partners. As a result, hundreds of thousands of children have received effective, culturally sensitive, evidence-based assessment and treatment for child traumatic stress. Network members have succeeded in moving this public health issue upstream from treating trauma in children and adults to helping it prevent it from happening in the first place. Together, we can help children grow up healthy and whole. Another example, our Children's Mental Health Initiative. SAMHSA, we're also strengthening families that raise emotionally healthy, self-confident children. This program began in 1993, creates family-driven, youth-guided systems of care in communities around the country. Dr. Barron noted that program right here in the district as well. More than $1.5 billion has been spent on this program since its inception. And even in lean fiscal years, the program has received funding increases because the data reveals it works. Children served in systems of care, research shows significant decreases in clinical systems. Not only that, but they're more likely to attend school and less likely to come in contact with juvenile justice systems. Equally important, children and youth who have the benefit of the program's wraparound services and things like peer support are more self-confident and better able to form healthy interpersonal relationships. Again, together, we can promote strong families and healthy children. My slides are a little out of order here. We've been missing a slide. Success of the Children's Mental Health Initiative is based on, in part, on our ability to strengthen the communities in which children and their families live and thrive. As President Obama has made clear, now is the time to protect children and communities by reducing gun violence and increasing access to mental health services. Last December 12th changed in this nation, shocked this nation with the horrible tragedy at Sandy Hook Elementary School. President, in response to the Sandy Hook tragedy, asked in his budget for fiscal year 14, $130 million for SAMHSA to help support mental health efforts to improve the mental health of our nation's youth. This includes $55 million for Project AWARE, standing for Advancing Wellness and Resilience in Education. AWARE is designed to increase awareness of mental health issues and to connect young people with behavioral health problems and their families to needed services. These help to support training programs for schools, teachers, and administrators using models such as mental health first aid. The effort includes working with departments of education and justice to fund competitive grants to local education agencies with the goals of making schools safer and providing mental health literacy training. President's budget request for SAMHSA also includes $25 million for the Healthy Transition Program to help 16 to 25-year-olds with behavioral health disorders and their families gain access to and navigate behavioral health systems. It also includes $50 million to address the workforce issues that Dr. Barron mentioned, to help train more than 5,000 additional professionals across the nation to work with students and young adults with mental health problems. This includes training, a wide range of providers, including social workers. Project AWARE builds on the success of our Safe Schools, Healthy Students initiative, which is a collaboration between SAMHSA and the Departments of Education and Justice. This effort has harnessed the power of schools, local law enforcement, community partners across the country, and it's making a difference. As a result of these partnerships, the Safe Schools program has shown that students, as a result of the program, witness fewer acts of violence, fewer involved in violent incidents, and teachers and students feel safer. Perhaps most importantly, the number of students who receive school-based mental health services increased by 263%, and the number who receive community-based services increased by a whopping 519%. Again, together we can create healthy communities with safe schools in which children can learn and thrive. Clearly, again, collaboration is at the heart of what it means to raise emotionally and mentally healthy kids. Each of the initiatives I highlighted, traumatic stress, mental health, safe schools, involve a wide-ranging number of partners from all the systems that interact with children at risk and their families. Again, no one agency, organization, or unit of government can do this challenging and rewarding work alone. As I noted, we're working closely with our federal partners to ensure that the behavioral health needs of children and youth remain front and center in the nation's dialogue about mental health. Earlier this year, we worked with the Centers for Medicaid and Medicare Care Services in releasing a joint information bulletin called Coverage of Behavioral Health Services for Children, Youth, and Young Adults with Significant Mental Health Conditions. A long title, but one that talks about how states and communities can finance children's mental health services. If you go to our website, SAMHSA.gov, that's SAMHSA.gov. If you go to our page on children there, you can find information about this particular resource and much more. We know this bulletin points out that states have significant flexibility in the Medicaid program to cover services for youth with behavioral health conditions. Clearly, one of the newest vehicles to serve children and families are health homes, authorized under the Affordable Care Act. Of course, the Affordable Care Act will provide parity for mental health and addiction services throughout the nation. The goals of health homes, which are authorized under the Affordable Care Act, are to provide comprehensive, coordinated, and cost-effective care for individuals with chronic conditions, including children and youth. Under the Affordable Care Act, half of the states have begun expanding their Medicaid programs to include individuals and families who have not previously been eligible for services. One of the issues that we hear a lot of, and that's concerns about the use of medication for children with mental health conditions. In this area, we're working with our partners at CMS and the Administration for Children and Families to ensure the safe and appropriate use of psychotropic medications for kids, particularly those in foster care. According to the Administration for Children and Families, nearly 50%, one half of kids in group or residential homes are taking at least one psychotropic drug. Many are taking multiple psychotropic medications. In many cases, these meds are appropriate, given foster children's greater mental health needs and exposure to traumatic experiences. However, there's limited research to guide the use of these drugs with children and youth. Such medications can carry a high risk of side effects. Among other activities, SAMHSA co-sponsored a national meeting last year in Chicago about the appropriate use of psychotropic medication in foster kids. We helped develop guidelines for community providers. We sponsored a child psychiatry fellow who works at our agency 1 day a week, and we support a youth advisory group to the American Academy of Child and Adolescent Psychiatry. Our goal is to ensure that young people get the right treatment at the right time and the right amount. Dr. Barron noted, and that was my earlier slide about the now is the time proposals for 14. As Dr. Barron noted earlier, perhaps most importantly, together we must raise public understanding and acceptance of mental health issues. We must, as President Obama invited us to do, join the conversation. As a result of the White House conference, people across the nation are organizing these community conversations, like Dr. Barron's noted. You can literally get on the map. These are just some examples of the communities across the country that are convening these conversations. If you go to the website, creatingcommunitysolutions.org, You can find information about this. Again, that's creatingcommunitysolutions.org. You can also participate on attending a gathering near you, and you can also help convene one yourself. To assist in this, SAMHSA published a toolkit for community conversations about mental health. As a result of the White House Conference on Mental Health, for the first time ever, we developed one website for federal mental health programs across the country. That's mentalhealth.gov. So if you go to the website mentalhealth.gov, you can find information about this toolkit that I mentioned, as well as about a range of information about mental health. And this is just not a federal effort. As I mentioned, it takes all of us in order to improve the mental health of the nation, particularly for our children and youth. Part of this effort, National Association of Broadcasters has developed a public awareness campaign to reduce negative attitudes about mental illness. Secondary school principals are holding assemblies on mental health awareness across the country. The YMCA is teaching its staff and camp counselors to recognize the signs of mental health problems. And communities of faith are launching new conversations about mental health in our houses of worship. Again, you can learn more about these efforts at mentalhealth.gov. Another example about the need for raising public awareness. And one example of what we're doing is Children's Mental Health Awareness Day. My colleague Lisa Rubenstein is going to be talking more about this later in the program today. But just in short, Children's Awareness Day is held every May. It's a key strategy of our Caring for Every Child's Mental Health campaign. This year we had more than 1,100 communities across the country conducting local activities. This photo of HHS Secretary Sebelius with Demi Lovato. We honored singer-songwriter and actress Demi Lovato for her work as a mentor to young adults with behavioral health conditions. During this day, we also released data about the outcomes for youth and young adults with mental health challenges. We reinforced the message that older adolescents and young adults with a supportive adult in their lives are more likely to finish high school, continue on to college, and form more positive attitudes and relationships. Each of us here today can offer that critical support. Next year's Awareness Day will be celebrated on May the 8th. It will focus on innovative strategies for supporting young adults in the areas of education, employment, housing, and schools. To close this morning, I'm reminded of the words of Nelson Mandela. He told us, "Safety and security don't just happen. They were the result of collective consensus and public investment." Collective consensus and public investment. We owe our children, the most vulnerable citizens in our society, a life free of violence and fear. We are at that point in this nation of a collective consensus, and we certainly need the public investment to address children's mental health issues. We owe children and youth in our country a life of good health, good emotional and good mental health, strong families, and supportive communities. We're here today to learn how collective consensus and public investment work hand in hand to support our nation's children and youth. Together, we can create a world in which promoting healthy social and emotional development across the lifespan begins at the earliest possible moment, that family members are supported in raising emotionally healthy, self-confident children, that schools are safe places to learn, grow, and thrive. Started my remarks today about the importance of us providing messages of hope, health, and recovery. I'm one example of hope, health, and recovery. As a child bullied, experiencing trauma, as a young adult involved in addictions and substance use, as someone who wanted to end his life on that day on that subway platform, to standing before you today as leading our nation's federal mental health program, living a full and happy life in the community with my family. Hope, health, and recovery are the messages of what we need to give for the future of our nation. Our children are counting on us. Let's not let them down. Thank you all very much.
Congresswoman Grace Napolitano, Democrat from California's 32nd District and the sponsor of the School Mental Health Act.
The program was started because SAMHSA had addressed the Hispanic Caucus on the needs of providing mental health services to Hispanics throughout the United States. Part of the presentation was the Latina adolescent suicide attempts were the highest percentage in the United States of attempted suicides. It still remains that way, although the percentage has been lowered. Second are African Americans, and then the third, the rest of the other Native Americans and others. What we tried to do was to be able to allow the providers to actually work with the child and be able to help them understand that there was help, that they needed to talk to somebody, because I don't know about any of you, but in my own family, my children would rather talk to somebody else than to me sometimes, because I'm the enforcer. So you understand it's easier for them to speak to others. And so this is what this program does, is allows an adult who is trained to be able to help this individual learn how to cope with their personal issues. And it's been successful so far. No attempted suicides in the 10, 12, 14 years almost that we've had the programs. And the county finally, LA County, one of the biggest county service providers, was finally able to recognize that it works, that it is a program that is effective, and it does help the child, and it helps the family learn how to work with the child, or to explain to the child, to the parents, what it is they can do to help the child cope with whatever is ailing them. So it's an existing program. It focuses on students. There's no questions asked about ability to pay, gender. Although it was Latina adolescent suicide prevention, the proviso for the provider to be chosen was that they would take any child under any circumstance. No money involved, there's no payment, and it's free, and so then it really does more than, they use some Medi-Cal dollars to stretch the funding that we were able to initially provide. Understand that because there are no earmarks, our funding was cut, which is when the county began to step in and address the expansion of the program because of the effectiveness they were showing, and also to be able to see where they could use other programs, other strategies that would help the child, the family, and the schools. We have a waiting list of schools wanting to have the program in their backyard. And what we've done in one of the schools is formulated a partnership with Kaiser, because they came in and put in a Latina, well, actually not Latina, it was just a pregnancy component, so that the young girls who were found to be expecting would be able to go not only through the mental health aspect of it, but also through the medical aspect through Kaiser. So we've been able to formulate the partnerships, and it has been very effective. So I just wanted to touch bases and let you know that 1 of 5 children in the U.S. suffer from some form of mental health issue. That 70% of the adolescents do not receive care, and is the 3rd leading cause of death for 15 to 24-year-olds, and is the fastest leading cause of death for children 10 to 14. Those are stats that come before me, and they're horrifying. And we need to be able to have more people understand that we need to put more funding in it, that we need to recognize that it is something that we're going to have to continue dealing with, especially in the aftermath of the tragedies we've had in the near past, not only here at the Naval Yard, but also in schools. And we need to be proactive rather than reactive. And this is something that all of you, speaking to your elected officials, speaking to those, and thank you to all of the people who worked so hard on this, is also the component of education of people to go into mental health service delivery, especially in a bilingual basis, because this is such a big world of ours in the U.S. We have so many languages being spoken.
Congresswoman Barbara Lee from California. She's the chair of the Congressional Social Work Caucus and responsible for us being here today. Congresswoman, there are social workers all over the country watching us today, and we'd like you to say a few words. Thank you.
Thank you very much. I'm sorry about having to run in and out. Votes were just called, and it's a busy day, but I am a proud social worker, first of all. And I just say to you that I only wish that my colleagues understood the social work code of ethics. I think we'd see a very different country and a very different world. I want to thank you for your tremendous leadership and just say a couple of things in terms of my background. Of course, by profession, I'm a psychiatric social worker. So mental health services, community mental health, children's mental health is a big priority for me, always has been. I want to call your attention to a bill that I've been introducing over and over and over again, H.R. 320, the Student Support Act. I really believe, and I think you know this, that our young people need more mental health counselors, more social workers at schools, so teachers can teach. And so hopefully, I mean, we've seen such tragic incidences of gun violence, and public safety at schools really are very scary in many ways. And more police officers, that's not going to do the trick. We need more social workers on campus. We need more people who understand what young people are going through. We need social workers to be able to identify any problems early on, because I truly believe that with more social workers and more mental health counselors on campus, we can we would see a reduction of school violence and a reduction of dropout rates. The dropout rates would be severely and dramatically reduced if we had more counselors on campus. So we need you as social workers and as advocates to really mobilize around the country, and of course I'm going to ask you to mobilize around H.R. 320. The day will come when that bill is going to get passed, and so I would hope that it's my social work caucus and my social workers who have pushed it through the process. So thank you again for being here today, but thank you again, more importantly, for what you do each and every day in these very difficult times. We were just at a press conference talking about this unconscionable cut in food stamps that's going to take place on Friday, regardless of the $40 billion cut in the Farm Bill. And we put additional funds in the Recovery Act several years ago. During hard economic times, we wanted people to be able to have that bridge over troubled water. Well, that bridge is still necessary, but unfortunately Friday, probably about $34 a month for a family of 4 will be lost as a result of the cuts that are going to take place. So raise the alarm, sound the alarm, ask people to call their members of Congress and to call the White House and ask them to help us stop this cut that's going to take place. So thank you again. So good to see everyone. Thank the panel.